Which of the following conditions can decrease sensitivity to sweet and bitter tastes? A. Rheumatoid arthritis. B. Psoriasis. C. Depression. D. ADHD. The answer is C. Depression. Depression has been linked with alterations in taste sensation, including decreased sensitivity to sweetness. This may contribute in some part to the high consumption of sweet foods and certain individuals experiencing a depressive episode. None of the other conditions listed have been correlated with alterations in taste receptor function. You're an emergency department nurse taking care of a 16-year-old female who complains of fatigue and syncope. You learn that she has only been drinking water for the last 2 weeks and has only been eating a piece of bread per day for the last 4 weeks, as she is worried that her classmates may make fun of her for being too fat during her upcoming dance. Her BMI is 14. Which of the following is the most likely diagnosis? A. Bulimia nervosa. B. Anorexia nervosa. C. Binge eating disorder. D. Major depressive disorder. E. Generalized anxiety disorder. The answer is B. Anorexia nervosa. In this patient, who is a young female, which is the most commonly encountered demographic for eating disorders, she notes that she has been drastically restricting her intake of food, that she has body dysmorphic thoughts, for example thinking that she is too fat despite that her BMI is 14, and we learn that her BMI is 14. A diagnosis of anorexia can be made if a patient is restricting their eating or drinking intentionally, and/or is participating in purge behavior, and has a BMI less than 17.5, as in this patient. While generalized anxiety disorder and/or major depressive disorder are often comorbid in patients with eating disorders, there is not enough evidence in the example to suggest either diagnosis for this patient. A syndrome of pain in the front of the knee, frequently occurring in teenagers, manual laborers, and athletes. It's sometimes caused by wearing down, roughening, or softening of the cartilage under the kneecap. What condition is described? A. Legg-Calvé syndrome. B. Osgood-Schlatter disease. C. Patellofemoral syndrome. D. Congenital scoliosis. The answer is C. Patellofemoral syndrome. Patellofemoral syndrome presents as pain in the front of the knee, sometimes caused by wearing down, roughening, or softening of the cartilage under the kneecap. Osgood-Schlatter disease is a syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. Legg-Calvé syndrome is due to disruption of blood flow to the femoral head, leading to a vascular necrosis. Congenital scoliosis is a spinal deformity characterized by the curving of the spine at an angle greater than 10 degrees on radiography. What condition is described by the following? A syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. A. Osteomalacia. B. Osteosarcoma. C. Osgood-Schlatter disease. D. Slipped capital femoral epiphysis. The answer is C. Osgood-Schlatter disease. Osgood-Schlatter syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. Risk factors may include overzealous exercise, but it's ultimately thought to be caused by adolescent bone growth. Osteosarcoma, The most common bone cancer in adolescent populations can present with pain and a lump or frank swelling. This is caused by actual tumor growth, not by any ligamentous issue. Osteosarcoma does present frequently in the knee, and must be ruled out before a diagnosis of Osgood-Schlatter disease is made. Slipped capital femoral epiphysis causes pain and reduced movement in the hip, rather than the knee. Osteomalacia is a general softening of the bones caused by a deficiency in vitamin D. What condition will show a pencil in cup deformity on X-ray? A. Psoriatic arthritis. B. Juvenile rheumatoid arthritis. C. Rheumatoid arthritis. D. Osteoarthritis. The answer is A. Psoriatic arthritis. Psoriatic arthritis will often show a pencil in cup deformity on X-ray. Osteoarthritis will show joint space narrowing, sclerosis, and osteophytes. Rheumatoid arthritis and juvenile rheumatoid arthritis will both show soft tissue swelling, joint space narrowing, and may show marginal erosions.